If you're someone struggling with low back tightness, SI joint discomfort, some deep aching in your hip, just never seems to go away, even that sharp pain that goes from hip to heel, it might not be your low back. It could be your piriformis. This is a small muscle that creates big problems in our hips, our pelvis, our back, and even how our knees move. So the piriformis sits deep in our glutes from the outside of our tailbone across the top of that bum towards that indent on the glute. That's the greater trochanter. So it kind of runs across the top of the bum and it helps control hip rotation and stabilize our pelvis. When it gets tight or overworked, it can limit hip mobility, pull on the SI joint and pelvis. It can change how your back moves or even affect how your knees alignment and track. In some cases, like I said, it can irritate the sciatic nerve, leading to that deep aching, nagging discomfort or that sharp pain down your leg. So instead of stretching your back, foam rolling randomly, or even just trying to exercise your way out of it, let's target it at the source. So what we use for that is balls for myofascial release or a foam roller. Something to keep in mind is the bigger the ball, the less pressure. The smaller the ball, the more pressure. The harder the ball, more pressure. Okay, so if you're new to this, you can use something like a foam roller or a big ball. I use a ProTech orb, or a softball will work as well, or a lacrosse ball, a dog ball, a baseball. We're going to take that ball and we're going to roll across the top back of that glute. We're going to make a figure 4 to open up our that piriformis, and we're going to roll across the top of the bum from the outside of then that SI joint across the top of the glute, trying to find that most tender spot. All right, then we're going to stay on it and we're going to breathe. Nice deep breath in. Exhale slowly. Trying to relax the leg, trying to relax that muscle. Of course, we do not want any tingling, burning, numbness sensation down that leg because this muscle does run over that sciatic nerve. We don't want to get on nerves. We want to protect them. So we should feel that hurts so good kind of massage type discomfort. And we want to hold that spot. So not just rolling all around, but hold that spot until we no longer feel that tenderness and we notice it kind of calm down and let go. So we can also do this standing against the wall so that you can really get into it if getting down on the ground is really hard for you to do. So after you release it, don't stop there. Reach out to me. Let's get activation exercises so that we can functionally calm that muscle, see how it feels in this new range of motion. If you want to move better, feel better, and actually fix the root of these movement patterns, follow along for more mobility, activation, and integration work. Drop a heart below to interact so I can get you feeling better faster.